and I'd like to welcome everyone here on this Friday afternoon. Let me start with the land acknowledgement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island. And we're grateful to have the opportunity to work on this land. Now, welcome everyone to a very special Dalhousie School of Public Health event, InfoWars, a panel discussion on journalism, public health, and the fight against mis and disinformation. This afternoon's discussion comes at an important time. As we slowly emerge from the worst of the pandemic, it's perhaps more important than ever to reflect on what we've learned thus far about the role of communications in managing adverse public health events and the critical role of evidence and information and data in how we improve and promote health and equity in health. Whether the role of journalists in our current social media and digital landscape has evolved, journalists retain an important place in our society as sources of truth and reason. This afternoon, the Dalhousie School of Public Health's journalism experts, Rob Steiner and Rob Cribb, will discuss the difficult tasks that journalists face in reporting on facts in a hyper-connected world. Learnings from some of the controversial COVID-related media movements over the last 2 years, and the evidence-based approaches we can all employ to combat mis and disinformation in our daily lives and champion the use of digital media for the public good. I'm really pleased as well that today's discussion will be moderated by Sabina Vohra-Miller, a current Dalhousie student, an alumnus of the University of Toronto, and a true friend of the school. With an academic background in clinical pharmacology and toxicology, Sabina is passionate about science education and advocacy and focuses much of her efforts on combating the avalanche of mis and disinformation on social media. She's the founder of Unambiguous Science, a digital space where she discusses new information on COVID-19 in a non-sensational and non-politicized manner, for which I am forever grateful. And my deepest thanks as well to our panelists this evening, Rob Steiner and Rob Cribb, for sharing their experience, their expertise, and guiding us toward a world of better public discourse. Now, without further delay, I'll turn things over to Sabina, who will introduce us to our panelists and get us started. Thank you, Sabina.
Hi, everyone. My name is Sabina Vohra-Miller. Thank you, Steiny, for the introduction. Very kind introduction, in fact. As Dean Steiny mentioned, we are here today to discuss important issues surrounding journalism and public health, a topic myself and, in fact, each of the panelists here is extremely passionate about. But before we get started, I will go over a few housekeeping items. The session will be recorded with closed captions, and the recording will be made publicly available on the Dalhousie School of Public Health's YouTube page after the event. We will be taking questions from the audience towards the end of the event. Please use the Q&A function throughout the event to ask the panelists your own questions, which will be answered live during the Q&A portion. And with that, it's my greatest pleasure to introduce our fantastic panelists for this afternoon, Robert Cribb and Robert Steiner. Robert Cribb is founder and director of the Investigative Journalism Bureau and an investigative reporter at the Toronto Star. He has received national and international reporting awards for investigations into offshore tax evasion, child exploitation, human trafficking, dangerous doctors, environmental threats, and public safety. He was part of the international reporting team that produced the Pulitzer Prize-winning Panama Papers investigation in 2017. Robert Cribb is founder of the National Student Investigative Reporting Network, past president of the Canadian Association of Journalists, the first international board member of Investigative Reporters and Editors, current president of Canadian journalism charity Revita's Advancing Journalism in the Public Interest. He teaches investigative reporting at Ryerson University's School of Journalism and as well at the University of Toronto. Welcome, Robert.
Thanks for having me. I'm grateful.
And then we also have another Robert on the panel today, Robert Steiner, who began his career as a global finance correspondent for the Wall Street Journal with postings in New York, Hong Kong, and Tokyo, where he was a finalist for the Pulitzer Prize, won 2 Overseas Press Club Awards, and the Inter-American Press Association Award. After leaving the Wall Street Journal, Steiner received his MBA from the Wharton School of Business at the University of Pennsylvania, and then worked as a business strategy executive, first at the Boston Consulting Group and later as Group Vice President in charge of strategic planning for Bell Global Media, parent of the Globe and Mail and CTV. From 2006 to 2010, Mr. Steiner served as Assistant Vice President of the University of Toronto in charge of strategic communications, as well as the Communication Director of the Ontario Science Table from January 2021 to April 2022. Welcome, Robert.
Thanks.
Okay, so with that, we're going to get into the meat of today's session. I'm going to start with a question for you, Mr. Cribb. I've heard you talk about the importance of precision journalism in service of the public good. Could you tell us about the Investigative Journalism Bureau and what it aims to accomplish for journalism and how this intersects with public health?
Yeah, thank you so much. So the Investigative Journalism Bureau, which is based at Dell Atlanta, is based on a really unique, what we think is a unique model anywhere in the world. So it's been in development for about 10 years, fine-tuning it, but effectively the principle is that we open up the tent, we break down all the walls between journalists and academics and researchers and students, and we bring everyone into the same tent to focus very strictly on issues of great public importance and to sort of merge brains and brain power and to put the story first. So the issue takes precedence over everything, and we bring in the best, smartest people. And then we simultaneously bring in young researchers, journalism students, practicum students, who obviously benefit from the process of doing the work, but simultaneously we're training them to be sort of this next generation of investigators. So it's a model that we think is beneficial for two reasons. It allows us to do stories with greater depth and scope, with more time. We're not sort of beholden to the traditional kind of constraints of newspaper newsrooms or broadcast newsrooms. Everything is based upon getting the most comprehensive, thorough information that is obtainable, and presenting it in a thorough, comprehensive way, accuracy trumping everything. And then we work with media partners, our main media partners, the Toronto Star, for publication. So it's effectively a collaboration of numerous parties. We've done projects that our first inaugural project brought together 10 universities from Stanford to Temple to CUNY to UBC to King's College, Carleton, and more than 80 people worked on this project that focused on unprecedented levels of mental health issues, including suicidality, anxiety, depression among young people. And we've done it numerous times since then. We're bringing in academics who are initially reluctant in many cases, but who have now seen the power of working with us in terms of reaching broader scope, broader audiences. And they work with us not as sources, not as how traditionally journalists sort of interviewed and got the soundbite or the quote. They're in from the start. So they are partners. We conceptualize projects together. Sometimes they bring us data, or we present to them data we've obtained through our methods, such as freedom of information, et cetera. And we sit down collaboratively and work through what is the best, most authoritative and comprehensive way to tell this story in a way that's going to reach a lot of people, which is going to obviously have tremendous public impact. Sometimes those journalistic stories end up as academic publications as well. So we're really trying to break down those walls, merge together, and ultimately serve the public interest through the most thorough kind of journalism that I've ever worked on in my career.
And, a true testament of the work that you've done is clearly highlighted with the number of awards the IJB has also won for the fantastic work that you and all of your collaborators have done. So it's incredible. Thank you for sharing that with us. Mr. Steiner, in a similar vein, can you share with us your role on the Ontario Science Table and why it has been so exceptionally critical, especially during the pandemic?
Oh, thanks. Well, actually, maybe I could just start by noting, while we're on the topic of what Dell Atlanta is doing in this area, I should also note the program that I run in partnership with Rob as well. So we're kind of like the teaching end of the same mission that Rob has at the IJB. I run the Fellowship in Global Journalism here, which recruits subject matter experts, not even experts, but people with advanced knowledge of their subject matter from around the world, disproportionately health professionals and health scientists. And we teach them to function as reporters, and some of them become full-time reporters, some of them become part-time reporters, some of them use the tools of journalism to shape evidence-based public discussions in their fields. So there's actually, one of the things that's neat about what's happening at Dell Atlanta right now is that we're actually, taking the step beyond the traditional understanding of policy education for public health professionals, which is really key, but we're taking the next step, which is actually helping public health professionals and health professionals generally shape the public conversation and advocate politically for what they need to do as, shape the public conversation as journalists and advocate politically with some of the same skills, but maybe in a different function. So it's really cool. And there are all sorts of ways for people, including alumni, to get involved in both. So thank you for having us there. On the science table, so I have to be sort of humble about this because really, a lot of the tone of the science table, well, in fact, all of the tone of the science table and its contribution was really set by, colleague, friend, boss, Steiner, our dean, who's co-chair, Brian Schwartz, who's also co-chair from Public Health Ontario, and our scientists led by Peter Uni, colleague at Dell. And I think that what the science table achieved, and I'm, obviously speaking with some bias here, but I think what the science table achieved was, it sounds a little defensive, but I think ultimately was really key, was in addition to providing, and most important thing it did was it provided a high volume of publication worthy science at an incredible rate. And the rigor is unbelievable. I mean, just to see it, I'm not a scientist, but obviously I work very closely with scientists, and to see the research operation function the way it did at the level it did and at the speed it did was amazing. But we're not the only place in the world that has something like that. One of the things that made us distinct was that we also kept it credible. And we kept the Ontario, and I think this is largely because of Ontarians, and we're very lucky to be here, was able to, by and large, not entirely, but by and large, keep the science credible for a very broad number of people. And I think that is both sort of a communications value that came into it. It very much reflects the values that I think Steiny, Peter, and Brian sort of really applied to this project, which was A, independence from the government without sort of being a critic of the government. We never wanted to be in that position. I think by and large, we stayed away from it. And also radical transparency about the process of science, including the ambiguities of science, the fact that science doesn't lead to an orthodox view, that there is scientific debate, and that we were prepared to answer any question that came to us, especially from journalists, but really almost any question that came to us, we're ready to do that without process and without being defensive. And that honestly is something that I think distinguishes this group from, for instance, SAGE in the UK and the CDC in the States, which are also, of course, outstanding scientific operations.
I actually really love how Dell Atlanta is becoming this hub for really impactful journalism, and making that mark that we actually need so desperately. And as you talk about, credibility, which I think we can see now with the pandemic, trust has been really at an all-time low, and credibility and the need for credible information is really there. And so, I think that a lot of it has to do with where we are with the creation of the internet, the evolution of this digital age that has transformed the communication landscape, essentially for all sectors, including healthcare, in fact, and health information. And as the pandemic has made really abundantly clear. So there's data from 2013, so this is pre-pandemic, that talked about how nearly 2/3 of adults sought health information online in the past year. And in fact, recent research suggests that this number is now closer to 75%. So 3/4 of people get their information online. And there are more than 1 billion health-related searches that are occurring on Google every day. I mean, I think Google should have an honorary doctorate degree. So, I mean, what I would love to hear from both of you today, panelists, is tell us about the current landscape of journalism and public health in this digital age. And perhaps maybe I'll start with you, Mr. Steiner, and then I'll pose the same question to you, Mr. Cribb.
Well, I should start by saying something I think good, I hope, about the web being a source, if you will, almost of primary care. Like, I hear that and I'm like, thank God, because at 1 a.m, when I worry that someone in my family might have a UTI and I'm not a doctor, I can go online and figure out what are the symptoms of a UTI, right? And when frankly, some overexcited resident tells someone in my family that she has a C. diff infection, I can go online, not being a doctor to be sure, but I know that Harvard is a pretty credible place, and so is the CDC. And I could see what the indications would be for an actual C. diff infection. And thank you, overexcited PGY1 resident in the emerge room. It's not a C. diff infection, it's something else. So I'm actually glad that we have online resources, and most of them are good. But what I think we're talking about is, I think there's kinds of 3 issues that for which I think in misinformation, when we talk about misinformation, disinformation, I actually think of it a bit more as a symptom of a few other things that are actually going on, and I'll touch on them pretty quickly. One, and they've all been highlighted by the pandemic. One is, I think there is an actual epistemological problem that we're now dealing with science, right? We ask, as people who are science informed or scientists, or I don't know, parascientists, maybe like on the periphery of science, like I am, we sort of ask and expect lay people to follow the science. But if you asked a scientist where they go when they follow the scientist will say, I go to the next question. The science only leads me to the next question. Science is not an ideology. It's not a political program. It is meant to change. Our understanding, all it is a process, a structured process of asking legitimate questions to lead us to deeper knowledge. That's all that science really is. And yet we turn around, we speak to the public, and we say, follow the science, as if this were a political program or the Bible or something, right? So, we then have to ask things like, is it actually misinformation to say that, I'm going to be provocative here, but deliberately, to say that hydroxychloroquine is an intervention in COVID? It is accurate to say that all recent studies would suggest it is not, and in fact has some dangers associated with it. But the fact is that if you followed the science, the first round of science was suggesting maybe. Same with ivermectin, right? Clearly, do not take ivermectin or hydroxy, just to be very clear. But, when we ask follow the science, we're not prepping people for the fact that science itself, epistemologically, science is not something to follow except to the next question. And I think we have to wrestle with that. And I think we have to be a bit more humble and transparent about what science is. I think the second thing is that when we talk about misinformation, what we're really talking about is polarization. And it often the problems that drive us nuts are really reflect a situation in which people will say, I don't want to trust anything this guy says. And when I say guy, I don't just mean, by the way, like this person says, I don't want to trust anything they say because their very position, their kind of existence offends me, right? Unless we think that that is only on the right side of the political spectrum, there are a lot of people, and I'm pretty progressive, there are a lot of people I feel that way about, right? And I have to check myself. There are a number of US senators, I don't want to trust a single thing that they say because I'm kind of offended that they're even senators. And yet I have to accept that they're senators, not my country anyways. But I think polarization is the disease and misinformation is the symptom. The last thing I'll say is that I think one of the issues that is driving misinformation, disinformation here is around equity. I think that we have, a lot of our systems have, for the best intended reasons, bought into the idea of equality that we've done it at the expense of equity. What do I mean? Equality, the notion of equality, which was, I suppose, a progressive idea back in the day when we pretended we were all the same. Equality is we're all the same and we all deserve the same information. We all deserve to be treated. Not a bad idea, except that it is completely blind to the differences that actually exist. And what it means is when it comes to information that we speak with one message as if everyone was hearing the same thing and everyone was tuning into the same channel. And we're not. We're all tuning into different channels and we're all living in different experiences. So very famously, as we all know in COVID, early COVID, we had a very broad-based in this province testing strategy that was not equitable, but it was kind of equal. In other words, like No one really had great testing, but if you get in a car and find your way down to a test site, you could get it, which meant that there were whole communities that weren't getting tested. Same with vaccine, right? On the other hand, when we had lockdowns, we were reflecting an experience that was largely urban, that was completely irrelevant to people in the north and people in, at the time when we were locking down in Toronto, and people in rural Ontario. So when you are treating people equally, but not equitably, you're basically leaving large groups of folks to their own devices to find stuff where they will. And they're not going out looking for conspiracy theories, by and large, some people do. I think what they're doing is, yeah, I saw that press conference, it came from New York. Oh, they have this thing going on in Italy. My aunt in India, who's a doctor, by the way, just sent me this thing that they're saying in Gujarat, et cetera, et cetera, et cetera. And I'm kind of putting it together for myself. And then we kind of have the chutzpah to call it disinformation. Sometimes it really is. Sometimes it really is like a bunch of jerks doing something kind of evil and nefarious. But I think often it's this. And so all of those things, and then I'll stop, all of those things sort of lend themselves to different ways that you could address, which we could talk later. That was a very long answer.
No, I think you actually brought up, I think you brought up some very, very important points. I think that, when people look at science, they think science is an absolute, but in fact, the only absolute in science is that there are no absolutes, right? And I also think that, coming back to some of your, some of what I hear you saying also is the fact that people do not know how to deal with uncertainty. I think that uncertainty causes a lot of these downstream impacts. And, frankly, the last 2 years have been filled with uncertainty. I think we don't really know the answers to a lot of questions that we didn't know 2 years ago either. And so I think a lot of this is compounded, I think, by what we're seeing right now. So, excellent insights in there. And Mr. Cribb, I'm going to pass that same question on to you. Do you want me to repeat the question, or are you?
No, I think I'm okay. I mean, in terms of the landscape as it's framed, I mean, I would just say it's deeply trenched, more so than I've ever seen it before. I mean, there's two things happening, right, which is really interesting. On the one hand, from a journalistic lens, strictly journalistic lens, we have just come through a global story for which there is rapt public attention, and journalists like that. We like people to be engaged in reading and responsive to what we are writing, and it's been the only story, and that's what we've been focused on. And we, so on the one hand, one might say it's been a remarkable moment for journalism, in the sense that it's hard to think of another story for such a prolonged period of time. There is such intense public readership, and you see it in the numbers and in the responses and the engagement levels. It is unprecedented in my life, and so that's good. On the other hand, it has been torturous, I would say, much more so for my female colleagues and journalists of color. I'm actually speaking to you from Montreal at a journalism conference. They just released this report on mental health of journalists for the first time in Canada. They've just published this, and the numbers are shocking, and so much of it has to do with COVID, obviously, because of the intensity, the daily intensity of vitriol and acidic responses that are endured by so many journalists. And it comes down to this notion of trenching or polarization, whatever you want to call it. There is very, very intensely felt responses to this. And I've spent time digging into the chat forums and the sort of the anti-vaxxer movement chat forums, which is a fascinating thing to do. And my colleagues have done some remarkable journalism on this, and I actually highly recommend it. It's important to understand this, right? Like it's easy to sort of simply dismiss all of this as crackpots, but it's not, I would suggest, the best response to it. It's understanding it, and it is deeply felt. It is cohesive. It's strategic. It's a remarkable thing, and this is largely the source of what has been the attack on journalism and to some extent science, right? So it's been a horrible time, I think, in so many ways for so many of us. And I don't think there's been any clear understanding on how to deal with it. I think because it is a new wheel. It is the invention of a new wheel, and we've never seen anything like it. And, we've sort of sputtered from response to response without really any clear understanding of what to do about how to react to it. And so we put our heads down, and on a daily basis, of course, we collectively do our very best to publish the most accurate and most contextualized information on a daily basis that is accessible. It changes as science does, and that in and of itself is a target, makes it a target. And so we're at a moment where there is I would say, a collective throwing up of the hands, I would say, in many newsrooms as to what to do. First, about the very practical issues of daily withering attacks, which in some cases are criminal. And then the larger, more philosophical challenges about, so how do we deal with this polarization? What is the responsibility of journalism? And practically, what is the step forward here? Because there's so much riding on this. I mean, I don't know that any of us have ever seen such divisions, philosophical division in our country and in our society as we're experiencing right now. And COVID is the trigger that's been pulled.
Yeah, I completely agree with you there with the divisiveness that we've been seeing. And it's really interesting you talk about some of these anti-vax or vaccine hesitant groups, because that's actually where I started doing a lot of my vaccine mis and disinformation targeting. It's really, really eye-opening to see some of the things that, the fears, the anxieties that actually result in some of these hesitancies. And they're not necessarily people who, set out to say, well, I'm going to go opposite to whatever public health is telling me. There are actually core fears that they have, and it's really interesting. Also, on the flip side, is being one step ahead of what you see is coming out as mis and disinformation when you're actually seeing it in real time and being able to address it sooner rather than before it actually has made a widespread impact. So, I mean, I definitely recommend that if any of you have not actually joined one such group, do that just to see, it is, I think, extremely eye-opening to see, what is out there, what is being said, and what are some of those inherent emotions that people who are anti-vax are coming from.
Can I jump in for a sec? Because I also think it's important in Ontario, and I'm distinguishing for a moment, I'm going to separate out the kind of vitriolic attacks that journalists are experiencing now. I completely agree. This is more of an unsafe time. I'm not sure that's great syntax, so apologies to Rob, my professional colleague, but it is a more dangerous time for more journalists in more fields than I think it's been before, emotionally and physically. We used to teach safety for the journalists we teach. We're going off for freelancers, and we ended up stopping it because most of the safety lessons were for sort of combat environments, and every year we'd have a couple people going off to those places, but most not. Now it's different. And I don't mean to, every downtown Toronto is like that, but it's so that is real. The disinformation, the anti-vax stuff is also real, but I want to put it in perspective, in context for Canada. So a couple of things to bear in mind. In Ontario, ages 30 plus, 90% of Ontarians 30 plus have 2 vaccines. Now, fewer than that, I think about 50% have 3 vaccines. But if they already have 2 vaccines, then their fall off for 3 vaccines is not because of anti-vaxxing. It's because of exhaustion. It's because it doesn't feel necessary. It's because it's hard to get time off work. It's all sorts of other reasons. But it's not, we should bear in mind that what is happening in parts of the United States is actually not happening in Ontario. We actually sat on the Oxford Stringency Index, which is a measure of public health, the public health measures, non-pharmaceutical interventions in a jurisdiction, basically how closed a place is. So the Oxford Stringency Index measures that. We have been, up until sort of the spring, we'd been at 80 for a long, long, long time without creating, be careful here because of course there was the trucker blockade, but by and large without creating a public backlash. That public backlash that happened with the trucker blockade, first, I'm not sure how broadly representative it was. Second, it was targeted at the federal government, not the provincial government. right, or says something, because all of these restrictions were provincial. What I'm saying is that there is a more adherent is not a great word for this, but there's a more conscientious consensus in Ontario than I think there is in other places. And I think that we should note that and kind of actually be proud of it, maybe. And the last thing that I'll note in this context is, and I'm not going to sort of reveal political preferences one way or another, but it was striking to me that at a time when, so the premier, it seemed, had a lot of kind of fellow travelers in the States, right? But the premier, you know, in the sense of having folks who weren't following scientific advice from time to time. In the case of the premier sometimes did during the worst days. But there was a point when the premier actually kicked a number of people out of caucus and even out of cabinet and locked the door behind them and said, you do not come into this room anymore, and you aren't even members of the party. That's significant, right? So, and not so much just about him, maybe it is about him, maybe it's not, but about the fact that we have a political environment here where there was no upside to keeping those guys in the room. There was only downside to keeping them in the room. So I think it's not to deny the threat, but I want to localize it a bit because, you know, again, clinically, if everyone you know has cancer and you feel a lump, you think you have cancer, but you may not, right? We're surrounded by the threat of misinformation. So we think we're dealing with the same problem here. We're dealing with our own problems here. They're a little different, but I'm not sure that this is the crisis for Canada and Ontario that it is in the US.
It's actually, I mean, I guess everything is relative, right? Yeah. So yeah. That's, and you brought up the trucker convoy, and I think there's also a question that sort of came up on a similar vein in the Q&A that I'm going to incorporate into the next question. And so, you know, I think we have seen, though, that in the last 2 years, there was a steep on-ramp for very blatant mis and disinformation campaigns. And as you mentioned, the trucker convoy was probably one of them. So in your opinion, and maybe notwithstanding what's happening specifically in Canada, but in general, what factors really enable this viral spread and prominence of such conspiratorial thinking and ideologies? And I'm also trying to understand, why is that such a threat to public health? And sorry, I'm gonna.
I could jump in, whatever you'd like.
Either way.
Oh, okay. I'll jump in, just get it going. One thing that struck me while I was doing the science table work, at one point it just sort of like struck me, and I started talking about it this way: that polarization is a social determinant of health. So I think that what it is, the landscape that is allowing this kind of thing to happen, and I don't want to minimize the significance of that convoy. There were a lot of people in that convoy, by the way, who are not anti-vaxxers, right? Who actually were vaccinated, but they had different priorities than a lot of people who were, and they were there not against vaccines necessarily. They were there against certain kinds of mandates, certain shutdowns. Their priorities were different, their values were different. But what it revealed to me anyway was just how polarized we actually are. And that polarization in Canada, I think, works differently than it does in the States. What really struck me in Ontario was that the axis of polarization for us in this province is actually rural-urban. And it's not that rural people are conservative and urban people are liberal. It's that we actually, you know, I'm not even putting it on that spectrum. It's that we actually have no idea how the other person lives. And so urban people are making decisions about life in rural regions of the province. And rural people, because they actually are more, you know, they at this point represent a majority of folks, at least in the last cabinet, we'll see about the next one, are making decisions for us living in urban areas, and neither of us understands the other, you know, how the other part of the province lives. So I think polarization is a key driver in this. Whatever that polarization, whatever the source of the polarization is, and I think it's partly because in public health. So you know what, I won't even go into the next step, right? Except to say that I think that we in public health don't have a tool. This is some of the work I'm doing. I'm now starting to do some work with the White House on this question. We do not have a tool in public health to listen rigorously enough to understand, to generate sentiment data, if you will, rigorously enough that it can sit alongside other epidemiological data in public health planning. So when we sit down at the science table, I use the broader we because I'm not one of the modelers, But when the colleagues sit down and model, they have a ton of data. They have data on spread. They have virology data. They have data, they have wastewater. They have all sorts of data that they're actually using to do it. Now, one of the issues is how adherent are people going to be with a particular non-pharmaceutical intervention? How many, one of the real questions is how many contacts will there be under different scenarios, right? We don't listen well enough to the population to understand, to be able to really predict that, because we don't know how they're experiencing the pandemic. And when we don't understand that, we're contributing to polarization, and we also aren't generating the right kinds of non-pharmaceutical interventions that are appropriate for the population at that moment. The other public health impact that polarization has is that in any polarized environment, all sides, all the political decision makers, and the political decision makers are the ones who count. It's not the public service so much as it is, there are probably public servants here, but the public servants would know that when you have a controversial public issue, it is rightly the role of elected people to make the decision. Those are the people we elect. And when a political environment becomes polarized, they become calcified. I cannot move out of my corner because I'll be killed if I do, because you expect me to stand on this and to die on this hill, right? The less polarized an environment is, the more flexible I am to follow the science. The more I can put up my hand and say, yeah, of course, we thought masks were bad 2 weeks ago, but the latest data come in and say they're not. And by the way, this decision on masks means nothing more than just masks. It's not about freedom. It's not about values. It's not about democracy. It is just about masks. And I can make that move because the environment is not polarized. But when the environment is polarized, I cannot move off the first thing I said. And that has real effects on public health. Okay, I'll stop there. So again,
I think you made a really good point. And I think, obviously Dean Steiner has been the one to speak all throughout the pandemic, as has the Ontario Science Table, about how that one size fits all rarely meets people where they are, right? And so I think that you really do hit the nail on the head here when you're talking about some of these guidelines that we are trying to fit into everyone's lives, and it just simply doesn't. So great points there. Mr. Cribb, would you like to add anything more to this conversation? And if not, I'm happy to move on as well.
Yeah, no, sure. On the rural-urban divide, we're seeing that too. There's no question in my mind that there's something real about that. I don't think we've got to the bottom of it, and I think it's going to take a lot more work. I don't think in any way that sort of is as tidy as it sounds, for sure. That's certainly not the case. But there is something real about that I think requires some really sort of thoughtful care and research to understand that better. In terms of the enabling of the viral spread, I mean, it's just very clear that it's the product of our age. I mean, it's very simple. It's very simple. And if you spend time in these forums, it is so simple to create a community around a philosophical idea and parse out everything that challenges it in ways that is new to humanity. I mean, the whole notion of the city square where ideas, in the marketplace of ideas, where all, there is no newspaper, there is no city square, there is no sort of base collective default set of facts which are tested and retested to the point where clarity emerges. It is very easy now to insulate and exist through algorithms to create thick walls to prevent any contrary viewpoints coming in. And certainly researchers and journalists have been wringing their hands over this for a number of years. I think this has been the ultimate expression of the new reality of how information flows into our brains. And again, the problem so that's one thing observing that, and I think it's very clear that we all understand that that's what's happening. But the problem is nobody's quite figured out what to do about that, and certainly journalism hasn't. I mean, so our response has been, let's just keep doing good work that is tested and meets standards and rigorous standards around fairness and balance and accuracy. And with this sort of seemingly naive hope that that's going to do it, it's just not. It's not working, and so that's where we stand.
Well, I was going to say that was a great segue talking about the good aspects of journalism. However, that did leave me a little defeated. But I do have to say, I follow everything that you write very closely, especially, some of the work that you've done extensively on investigating environmental exposures, whether it's lead in water or air pollution and climate change. And we also know that these impacts are acutely and disproportionately felt by racialized communities. So not surprisingly, many of these areas are severely underfunded, and yet they play a critical role in our well-being and our health. And so could you tell us maybe a little more about the role journalism plays in bringing awareness on these issues and educating the public on these really critical matters of public health?
Yeah, I mean, it's the reason we exist. It's the reason the IJB exists. There's such incredible challenges faced by all of us, and in so many cases we just don't understand how we are being impacted. And I say this as a journalist working on these stories. I mean, I was totally blind to issues such as lead in my tap water. I mean, I knew nothing about this. I read a lot every day, and it wasn't until I had a kid and I was reading a parenting magazine and there was a little blurb about lead in the water, and I thought, what's this about? And I got my house tested, my tap water tested, and I was off the chart. I didn't know. It was totally happening. And then that set about a large, what ultimately ended up being a multi-year project into levels of lead in our drinking water. And as you say, it's predominantly a problem in downtown, older infrastructure in the city. Often that means areas where poor, more disenfranchised people live. It's not easy to fix. It's expensive. If it's on your property, you have to pay for it, sometimes thousands of dollars. Many people, even if they're aware of it, can't even fix it. And so this led to very aggressive advocacy style journalism in which we challenged cities across the country. We assembled a huge team of people, took tests from across the country, identified cities and towns where there was huge elevations well beyond safety standards, and ultimately forced through like sheer humiliation and embarrassment, cities to invest hundreds of millions of dollars in infrastructure to pull out lead pipes, which is the only solution. Not only on the city side, but in some cases in Halifax, a ground international program where they're paying for the removal of lead pipes, not only on city property, but on private property, to ensure at the end of the day that it just gets out of there. Whether or not you have the ability to pay for it, the city in Halifax is paying for it. So those are great moments, of course, when you can affect that kind of change and see it happening. Those are good days in journalism. There's a lot of bad days where that doesn't happen. But you're increasing your odds. This model that we got, I firmly believe, when we're able to throw the kind of brain power and academic and journalistic methodologies and strategies, merge them together, and then throw onto that the energy and passion of young researchers and reporters, you're increasing your odds hugely of doing meaningful work that is going to compel politicians, lawmakers, and the public to act. And we're seeing it happen. It's like we're new, we're young, we've only been around for a year and a half, 2 years, but already we're seeing the kind of public, meaningful public impact from these stories because they are largely untold. And the reason they're untold is because it's really hard to do. These are massive, sweeping investigations that are national in scope and take incredible resources that no newsroom in this country could ever assemble, including the CBC or the Toronto Star. There's just no way. We had like 100 people working on the lead story. We had almost 100 people working on youth mental health, and it's only because we had this ability to assemble this army that we were able to tell stories that were so in depth and sort of beyond attack and dismissal that it's compelling that kind of response. And so my answer to the question is, this is a big part of the answer. I think if you can do journalism at that level, by incorporating all of these different skills, methodologies, viewpoints, perspectives, I think you can get to a point where you're doing works that is so compelling that it cannot be dismissed by anybody, wherever you stand on the political spectrum. It's just too compelling to ignore.
Okay, so that gives me a lot more hope. You know, it's really amazing to see how good journalism can actually fight some of this, advocate for what is necessary, raise awareness, raise education on these really critical topics. In your experience, as a follow-up question, have you seen similar good journalism fight COVID conspiracies, and has that been effective, or are there limitations that are pertaining to, you know, more specifically to what we're seeing on the COVID front?
I've seen great journalism on this file. In my own newspaper, The Star, I mean, there's been some remarkable stuff, digging deep on these issues and addressing them directly. The kind of fact check, what we call fact check reporting, where you go forensically, point by point of every assertion and test it against what is known to be true by reputable sources. So do we do that work? Yeah, 100%. I think all the big media organizations are doing that kind of work, and I think it's terrific work. And I think to some extent, it is having impact. What ends up happening, though, is that you're often preaching to the choir, right? Because those who are insulated against MSM, mainstream media, are you going to reach them? And that's the great challenge. And I think in many cases, the answer has become no, because it is now technically possible to be beyond reach. And so what do you do about that? But I will certainly say, in defense of Canadian journalism, that work is being done, and there's tremendous investment and engagement in newsrooms across the country in doing that work.
I mean, if you think about it, right? Think about the fact that you can now basically go up to most people in the street, at a bus stop, whatever, and folks will know, first of all, they'll know what a virus is. They'll know, here's what they'll basically know about COVID. They'll know what a virus is. They'll have some idea what mRNA is. They'll know that how viruses spread. They'll know what the symptoms are. They'll know, by and large, when you need to go to the hospital and when you don't. So they'll be able to do some elementary diagnosis. They'll have some sense of what long COVID is. They'll have some sense of whether it's getting worse or getting better and why. They'll be able to correlate it to vaccine and masking. They know what the word endemic means. They know what waves are. They know a whole bunch of epidemiological terms and concepts, and not just the terms, but could point to them on a sheet, that we didn't know 2 years ago. And here's what I'll say, and it's bold, but I don't know any other explanation for it. Everyone who knows that stuff, who is not themselves an epidemiologist or public health scientist or an infectious disease person, knows it because of a journalist. Where else did you get your information from, right? We weren't born knowing what an epidemiological wave was. You know it because of a journalist. Or if you know it because of your aunt who told you, she knows it because of a journalist. So holy smokes, like we have an infectious disease and immunology is one of the most difficult parts of science, of health science, life science, bioscience at all. And we now have a basically illiterate population. Thank you, Rob. Thank you, journalists. Thank you, columnists of the Toronto Star, et cetera, et cetera. And I'll take my hat off to the folks in my own program. One thing I want to add, though, about what makes journalism unique as a contributor in this. And I saw this, because I was fortunate enough to be wearing like two hats when I was Science Table comms director. That was not really my day job. I was doing that on the side. My day job is running the Fellowship in Global Journalism, training and teaching people like doctors how to work like journalists, how to be journalists. And one of our folks, Rob will know exactly what I'm talking about when I mention this, Radha Kohli, who is she's an ophthalmologist. She's vice chair of ophthalmology at Sunnybrook, and was learning to be an investigative journalist in our program, or journalist generally, but was also involved in some investigative work. So at the Science Table, we kept banging our heads against the wall, trying to figure out what was the epidemiology of youth mental health, in particular suicidality, self-harm, all this kind of stuff. And when you actually go, it's just a bit of a case study. What journalism does is different than normal health systems research. When you go into the health systems research, you get, first of all, it's late. By the time you figure out who's been admitted to hospital, it's sort of 6 months old. Second of all you're getting are hospital admissions, because that's what our public health system gathers. I'm sure there are experts here who will correct me on the details, but broadly speaking, I think that's basically what you're getting. You do not have a sense from the public health data, from the health system data, of how many folks are seeing social workers, psychotherapists, psychologists in the community, all these things that aren't captured by OHIP. If they're in the hospital, they're being coded in a certain way depending on how they present it, which may be a mental health issue, maybe an eating disorder. That may also be something that is not ostensibly like that. It might be, as in the cases of people I know, they went in to get their heart rate checked. Why? Because of a concern about an eating disorder, but it's not coded that way. So as a science table, we could not get our heads around this. The only datum that we could get was suicide or admissions for suicide attempts, and they were down. But we knew that we couldn't extrapolate from that to say the kids are all right, because the kids clearly weren't all right. It was a journalist, it was Rada working with Rob, who was able to figure out, because she's a physician, she knows how coding kind of works. She knows the questions to ask. She knows how defensive a hospital is going to be about this stuff. And because Rob is an investigative journalist and Rada is learning to be a journalist and functioning as a journalist, they could interview a ton of people and then come out with something that was rigorous, but beyond the scope of traditional academic research, that ended up on, I think, on page 1 of the Star, that said eating disorder admissions or related admissions are up as of the last 6 weeks, more recent than any data we could get out of the system. And that changed the picture. Finally, we had something we could use that was beyond the scope of traditional public health and health systems research.
Yeah, no, for sure. That is absolutely incredible. And you know, a couple of the things that both of you have sort of mentioned, I want to dig deep a little into it. So, I mean, I think that, you know, we've talked about journalism and what a powerful role it has played throughout the pandemic. On the flip side of that, the pandemic has also heightened trends around mistrust in media. And that has been, you know, a trend that we've sort of been seeing over the last few years, but I think has really been heightened over the last 2 years. And so, you know, I guess I would also like to ask both of you, and maybe I'll start with you, Mr. Cribb, about the public's interactions and expectations from journalists and other news media. Has this changed, and are these changes concerning? And you know, how do you build back some of that trust?
Yeah, it's one of the deep, troubling elements of all of this. I'll just reference this session I just went to this morning again. This study on mental health in newsrooms, and there was a bunch of quotes from respondents to this survey. So a number of them said things like, you know, it's challenging enough to do this work. You're working 12, 15-hour days talking to families who've lost loved ones and very much being vicariously traumatized by the sheer weight of this work. And then to realize you publish the next day and then you get attacked, to realize that even through all of that, there is such profound distrust in that work that you're doing. It's dispiriting, to be sure, and it's one of the sort of the resonant data metric points that came out of that study that was released today. So yeah, it feels worse than ever. Not that it's ever been great, but and I think there's data on this that shows that trust in journalism is at an all-time low, or certainly as low as it's ever been. And it's totally confounding to me. I have no comment on it other than to say from the lens that I see on a daily basis bears no resemblance to the way journalism is perceived by clearly a huge number of people. It is a disconnect that is beyond comprehension to me. I just don't know where such deep and profound misunderstanding comes from. I just don't know. Do we make mistakes? 100%. And then we publish them the next day, clearly, on page 2. And so when we do, we say it, but you know, overwhelmingly, there has been a remarkable effort every single day. And I don't know what to say other than it seems clear that there is a huge disconnect between the work that we're doing and the way it's being perceived. That's all I can say. I know nothing more than that.
I'm just looking right now. Sorry, you'll see me kind of scrolling here, but I'm just looking at the Edelman Trust Index. It's interesting. The Edelman Trust Index. So this is Edelman, the big PR firm, does what's considered to be a widely credible index of trust on various factors, social trust around the world, and then they disaggregate it by country. And so this is the 2021 trust barometer. So I suppose the latest one available. So 2021, trust in traditional media had fallen 10% from 65 to 55% from 2020 to 2021. It had fallen from 71% in 2019. So it was lower than it had been at any time since 2017, let's say. On the other hand, it was higher than any other form of trust in traditional media was higher than any other form of media. So it was higher than social media, 22%, owned media, which is, I'm not quite sure how they define that. Search engines, 47%. So, I'm certainly not countering anything that Rob was saying. It is actually a brutal time. I see it less than him personally, but I had a fellow in my program who published something in the Washington Post. And then we spent the next 2 weeks in our program helping her manage the fact that she had become the cause of the day on Fox News. And it was brutal for her. And that happens now every year. So I'm not quite sure where I was going to go with that, other than to say yes. Yeah.
Okay, but so what do you think's going on then?
I did have a thought on this. I think that, sorry, just give me a quick second. In terms of the mistrust that people are feeling about journalism, I'm not sure. I think that part of it is, again, I just keep coming back to the fact that we're kind of polarized. And I think that, sorry, if you let me come back to that in a moment. Before I got distracted by the actual data, there was something cogent I had to say, but I've been teaching all day and it's just sort of slipped my mind, but I'll have something cogent.
You know what? I would love to try and answer that also.
Yeah.
So, I mean, what I have actually come across through a lot of this is it's not just misinformation, but it's in fact large quantities of information. And people sometimes just don't know what is actually accurate, what should they believe. And there are times when there is debate, right? When there is scientific debate, for instance, there are times when in fact there are different opinions on certain aspects. And from a general public, sometimes it can seem like, well, that mainstream media or that publication or that scientist or physician is telling me this, whereas I've heard this elsewhere. And it's hard sometimes for people to reconcile. What are they supposed to believe? What are they supposed to trust? And so maybe, one of my questions also could be, how do people discern what is credible, what is accurate, what isn't? What should be given more? I mean, I think for us as scientists and researchers, we have a really good hierarchy of evidence that we follow. But the general public, that's not necessarily true. And so how do we actually teach them or tell them how to discern when there's such large volumes of information out there?
The other thing is, it's not an entirely, I'll say it is a very, how do I put it? It is a very dangerous manifestation of something that is not entirely bad as a trend. Here's what I mean. I think we have been taught over the course of a generation to be critical, broadly critical. And that's really good, because there was a time not so long ago when the New York Times could actually say, maybe they still do, I haven't looked at the physical paper in a long time, says all the news that's fit to print. Or Walter Cronkite, after a 22-minute broadcast, could say that's the way it is. And everyone just sort of said, I suppose that is the way it is. You haven't said anything about India or China in about 4 months on the CBS Evening News broadcast, but I suppose that's still the way it is. So we have learned actually to say, is that really the way it is? Are there more things that you guys haven't actually sort of explored? And at its best, that's really good. Where it starts to also get really problematic is I think that most folks don't understand, and I'm going to say I'm defensive, don't understand how much work goes into journalism. They think that journalists just sort of take dictation or take a leak and will, so to speak, excuse me, but get a leak, receive a leak, and will take dictation from someone. They have no idea. When I was a young journalist working for the Wall Street Journal, my dad is a research scientist. He's now retired at U of T. At one point I was on holiday and my mom sat listening to me on the phone with my editor in New York. I was a foreign correspondent, and I spent 2 hours going through this story on the phone. And my mom said, "Oh my God, you're doing more work on this than your dad does on one of his papers." Now, that's not true. My dad worked very hard on his papers, but she was shocked and this was just one conversation, one of like a month's worth of conversations where they continued, to rip new orifices in my body around this story that I had filed before it finally got out. And what you hear sometimes from folks, and I heard this from no less than the chief of police at the time, Mark Saunders, in a meeting that I happened to be sitting in, they make stuff up. They speak with one guy, and I could tell you, this is when he was chief of police, I could tell you that's not what's going on. And I had to step in and just say, "I'm sorry, Chief, I know I'm not really part of this meeting, but I can promise you they're not making stuff up. What they're doing is they're speaking to people you cannot speak to. There are a whole bunch of people in that community who will never speak to you. And and that's fine also, because you're operating within very strict legal constraints. You're only allowed to speak to these people and only about this, because it has to do with the legal case. We could speak to people about the context, and we know how to speak to people in a way that they will actually want to speak to us. That's our training as journalists. And so you are getting a different picture. And I'm sorry that it doesn't conform to yours. But when you come into that with a profound sense of identity, and that you feel that the world that you experience is the whole world. And I now have the tools of critique, which are very sophisticated social tools, in order to break something else down. I don't have a reason to trust unless I also know how much work actually goes into this. So by the time I'm hearing it, it's actually evident. I will say, last point I'll say is that this is why I am a huge fan, and why we teach in my program. We focus on teaching reporting rather than opinion writing. Everyone has an opinion, and opinions only create more reaction, and opinions polarize. But the place, the kind of fertile place where people can actually come together, and even if it's just for a moment, say, excuse my language, like, "Holy smokes, I didn't realize that this was going on." Not yet polarized, might be polarized in 5 minutes, but for the moment it isn't. So I can wake up a little bit and I can actually chat with someone. To Rob's point, I don't care what his political opinion is. We both have lead pipes. Holy smokes, that's reporting. When you show the data, when you do what Rob does, that's the piece that actually wakes people up just enough for a moment. And there are a lot of issues that are not that polarized, largely thanks, I think, to reporting. But sorry, Rob, I saw you were going to jump in.
No, I agree with you. I wish, maybe this is partly the fault of journalism, but I do wish there was a clear understanding of what goes into this. We're about to publish a series, an investigative series, that is literally 4 years in the making. Fighting for the data from the governments, dozens of freedom of information requests, appeals, fights, get the data, months of analysis, and then a year and a half of work to refine all of that down into 3 stories. I just don't think that there is a public perception of that. There seems to be this notion, and this is what I hear at dinner parties, that we wake up in the morning and we throw a dart at the dartboard and say, "I'm going to be an expert in this today, and this is what I think about it," and the story is filed by 3 o'clock. It's just not true. And not the kind of work that we're doing, not the big picture stuff. There's daily reporting, of course, by seasoned professionals, but the kind of big picture work that often is the target of this kind of criticism is the result of incredibly lengthy, rigorous editorial, legal review, as well as intense data work in many cases. I mean, and then at the IJB, then you were bringing in layers on top of that in terms of career academics who've worked in this area, data analysts. I mean, I just wish that there was some clear understanding of that before these dismissive waves of the hand are made from so many. The other thing I was going to say, in an attempt to answer my own question as to why there would be such levels of distrust, I think some of it goes back to this notion we talked about earlier about the nature of science. In many ways, there is a fluidity, and there has been during COVID, right? There's a fluidity in the advice and the facts and the protocols. So we all remember, it wasn't that long ago, we listened to Dr. Tam say, don't wear masks. Don't wear masks. It makes it worse, right? It changed. We heard no airborne transmission. It's not airborne. It's not airborne. It changed. And to some extent, and of course, the journalism changes with that. As the scientific evidence builds and ultimately reaches a tipping point and there is a change, the messaging changes. And I'm theorizing here, and I'm not an expert in this, but it strikes me, if I think about the hate mail that I get, often it's, you guys are making this stuff up every day as you go. I read the story you wrote whenever it was, and you said this, and now you're saying that. You're making it up. It's literally made up. You're liars. And so to some extent, I think that's part of it. I don't think that's all of it, but I do think part of it is the message changes. And when that happens, it feels, I think, like a shifting of the ground for so many people. And then they go, well, then we can't trust anything. It's all nonsense then.
So there is a model. Sorry, do you mind if we keep going on this, Sabina?
Yeah, sure. This conversation is exceptionally interesting, and especially to me personally, because I think that what people don't understand is that policy is always playing catch up to science. And during the pandemic, science has really moved so quickly that policy is moving so quickly. But I mean, I think one thing we haven't done a good job of explaining to the people is that when policy does change based on evidence, it means that it's actually following science, following the evidence, right?
That's right. And there's a model of communications for this. So this is actually some of the work that I've now in the last sort of month with one of my alumni I'm doing with the White House. So I have an alumna, her name is Sabina Yasmin, former public health doc, epidemic intelligence officer with the CDC, who was in my program, became a journalist, worked at the Dallas Morning News, is now at Stanford. And she and I have been sort of pulled into this discussion that's happening in the White House about long-term pandemic planning and how to restore trust in public health agencies, particularly the CDC, but we're now looking a little more broadly than that. And one of the things, and Steiner and I have talked about this over the past couple of years too, one of the things is that medicine actually has, and frankly, so does social work, and so does nursing. And nursing and social work, I think, are and I hope that there's some social workers and nurses on this call, because they are the unsung heroes of a lot of healthcare, right? And I think medicine is kind of catching up. But medicine had this revolution 40 years ago, right, in patient-centered care. And the notion of patient-centered care in medicine was, if this is not about the specialist looking at a pathology and everyone saying, Herr, Frau, Doctor, Professor, Doctor, we will follow whatever you say. This is about, ideally, and a lot of places doesn't work, but ideally, this is about an integrated healthcare team where the physician is one member of the team, along with the nurse, the social worker, whoever else it may be, another couple of docs maybe, and the other part of the healthcare team is the patient themselves or the family. And the physician and the healthcare team is spending a lot of their time listening to understand the family's own values and the family and the patient's own sense of their own well-being. And then crafting, particularly in things like chronic care, crafting interventions that will make sense and making trade-offs that will make sense, that will actually make sense for that patient, right? So that if you're treating diabetes and your patient cannot adhere to a certain eating regime because she's a senior partner at a law firm and travels 6 days a week, I'm not going to expect you to drop your job. We're going to work with that, right? There will be trade-offs. There will be trade-offs. You know, you might not be as healthy as if you just stayed at home, but maybe you'll be a little healthier because you can afford your gym membership. I don't know. There are trade-offs, but you're the patient. We do that in medicine now. And it is built around very disciplined listening that goes beyond just taking diagnostic history. We don't do it in public health. In public health, we still adhere to this notion of communications, which is, I will tell you what you do, and you will do it, or you will die, or more likely someone you care about will die, and that is a problem. And if you don't do it, also you're ignorant. That's kind of the mode. We don't put it in those terms, but you can tell. That's sort of how we speak. And then I've been in the room, I'm not talking about the science table, it's not related to the science table, but I've been in other rooms with medical officers of health who actually kind of speak this way. It's like, I can't believe those idiots in my unit who don't listen, right? And then the next person says, Yep, it's like my patient back when I was a family doc. I told them they were going to have a heart attack, and they just kept drinking wine, smoking, eating steak, and guess what? They had a heart attack. I'm like, you know what? If that's the approach, then don't blame them for reacting. What we can do, and actually what the South Africans do, is they have a structured process of listening to the public week by week about how they're experiencing COVID, and generating the kind of data, anecdotal, but it's aggregated and it's longitudinal. So it actually allows you to have a bit of a rigorous picture. They generate data that goes into the public health decision-making alongside all the epi data, virological data, and all that kind of stuff. That's kind of the beginning, right? When we can listen. We're not talking about journalism right now, but what is similar, what's very similar to, to what comes up when I teach physicians and public health people how to be journalists is, let's be a little humble. Let's be a little humble. You as the professional, you are one piece of this puzzle. And if you're a physician, I hate to tell you, although most physicians now agree with this, you're not even the most important piece of this puzzle. In this case, the social work will be the most important piece of this puzzle, whatever it is. As a reporter, when you learn to be a reporter, that is where you start. I don't know. It's a topic I've been following for years, but I have no idea how it actually is working on the ground, which is why I have to interview someone. So these are the values I think that can help move us forward and rebuild trust. But I won't be naive about it either. Anyway, I feel like I'm preaching, but
I think this is a great segue actually to talk about solutions. And we have had a couple of questions on that and that were submitted. So one of the questions was, do you think scientists are partially responsible for how information is perceived by the public? And how can scientists do better in their knowledge translation skills? And I think even broader in terms of healthcare professionals, so other subject matter experts, how can they become more effective in translating the knowledge better, or combating misinformation, or raising awareness? And I'll just throw it out there, and whoever wants to pick this, please jump in.
Rob, you're in those conversations every day with your collaborators.
Yes, I've learned a lot about this concept of knowledge translation in academia over the last year working with academics. It can be way better. This is one area where I think the IJB and what we're doing can play a really vital and important role. I don't think there's enough. So let me be, I'm an outsider, so let me just be clear. I'm a newcomer to this world, and what I've learned is that there seems to be tremendous interest in this concept of knowledge translation. But when I look at it as an outsider, in terms of what that actually means in its execution currently, it feels very modest to me. It feels very modest. And so it does not encompass the kinds of things that will bring to the public at large the insights and knowledge that come from serious academic study. And so one of the roles that I'm trying to develop for us is directly in answer to your question, right? So how can they play a larger role with that? I mean, they can work with journalists, and what I mean by that is not writing a press release. Although that may be part of it, but really to work with journalists who are clearly predisposed to this kind of subject matter that they are interested in, and develop real strategies, storytelling strategies, in order to take the research and turn it into the kind of material that is going to have resonance and meaning in the public. And that means not just summarizing in bullet point form the data findings. It means turning it into journalism. Yeah. It means finding the heartbeat, finding the narrative, finding ways to make the academic, the clinical research findings have substance and meaning for those who are going to receive it. I don't think we're doing a very good job of that at universities, and I think this is a really important role that I think that the IJB can play. So one answer is not going to reach everybody, but one small answer is finding that partnership, first of all being open to it, and that's the first step. These are things I'm learning. Many aren't, and never will be, and I get that, but some are, and some are being slowly brought on to this notion and seeing it. And we're seeing them come back to us, I mean, and say, let's do more of this. This has been remarkable. We did a piece on radon levels in Canadian homes with a University of Calgary researcher who is the luminary on this, and he had this remarkable data set of radon tests across the country. We took 6 months on this project. We published it, front page of the Star. It impacted him immediately, right? So his data is his research. So overnight, there was like a 5,000% increase in the number of Canadians who wanted to get radon tests in their homes. So his data, which is the basis upon his research, suddenly blows up, and it's continued to do so. And so now he's come back, he's written this into funding proposals, and he wants to do some more, and we're all ears on it, right? So these are the kinds of things, like, we're building real evidence that this is a sustainable and impactful model that can benefit academics as well as ultimately journalists, and most importantly, the public. So I'm incredibly heartened. Sabina, if you're looking for good news, I mean, I actually think there's plenty of it when we look at the things that are just starting to build here, and it's totally replicable. What we're doing is totally replicable anywhere in the country.
So this is exactly what we're doing with the Fellowship of Global Journalists, and we've been doing it for 10 years, right? So we've had, I think, 250 people come through the program who are doing exactly what Rob is talking about, right? We are mentoring them for 8 months as they work as journalists for media partners that we have: the Toronto Star, CBC, the Canadian Press, the Dallas Morning News, the Boston Globe, et cetera. And what's happening is, first of all, they're learning to function and think like journalists. A chunk of them become journalists, right? Some folks become full-time journalists. So we have, I mentioned that one of them, Seema, went on to the Dallas Morning News, immediately hired as their health correspondent. Another one went to Vox just now. Another public health doc went to Vox. We have folks at the Washington Post, the Financial Times, CBC, the Star, the Globe and Mail, and on and on. But a lot of them actually go back to the clinic or go back to the lab or go back to the agency where they're working. But now they've spent 8 months being mentored, not only being mentored as in journalism, but working as journalists under mentorship from people like Rob Cribb, who teaches investigative in the program, and me, and the folks who we actually have, mentoring them individually on their stories as their stories run in these major media. And the difference is incredible. I was just teaching earlier today with an alumna who's a lawyer basically for workers' comp, for people who need workers' comp. It's an injured workers' law clinic. Tabassum Drani, I don't know if you remember her, Rob. So Tabassum, I was asking her in the context of this class, how has this changed your advocacy work? Because you're not writing a ton, but I don't expect you to, you're a lawyer. It completely changes the way that she interacts with journalists. She is no longer trying to push a story, push an idea, push an agenda from her organization. She knows how to identify a story, an issue, and be able to put it in a way that a journalist gets excited about, which also is quite humble, right? It's also like, I'm only one part of this. There are 5 other people you need to speak to, and here are the data. And this is why it's surprising. This is why it doesn't fit into the story that you think you knew. And here's why it's really important. It's going to change things within 3 months in Ontario if no one deals with it at the moment. So, and here's a cool thing that I've learned in doing this for a decade. Everyone can learn this, actually. So, one way to do it is to be deeply involved when Rob gives you a call, or when you have an idea about an investigative piece, something in the system that needs fixing, give Rob and the IJB a call. Investigative Journalism Bureau, IJB, you just Google it and you'll find Rob's connection. If you actually want to learn how to do this work on your own beats, in addition to that, come to us. And frankly, we're tied up with the IJB anyway. So there's a lot of resources now, and this is for, alumni, for anyone in the community, right? To actually learn to think journalistically, whatever you're going to do. But certainly Rob, the 2 Robs, you don't have to be named Rob, by the way, but the 2 Robs are keen to actually help people start thinking like journalists, because I think that is actually part of the solution.
I completely agree. And I love that. And I love that Dalana is, really at the main center of all of this work that is being done. I think we have time for one last question. We're probably in our last 5 minutes of this panel. And there's actually 2 questions that really talk about the role or what role really should the government play in all of this? So the first question is, did the level of trust in journalism decrease since 2016 with attacks on journalists from, as high as the President of the United States and other senior politicians? And wasn't that an attempt to stop people listening to legitimate investigative journalists and instead actually listen to opinion journalism and self-preserving propaganda? And on the flip side, there's a question about what role should the government take in terms of addressing mis and disinformation? And are there any known strategies for public service to foster greater trust in government messaging? And again, I'll keep this open to anyone.
Yeah, I totally agree that Trump was a turning point for sure. That the mantra, the fake news, it's not that he invented it, but when the most powerful person on the planet repeats it every day, there's no question that had impact. The moment I think everything changed is, do you remember this incredible moment? It was Kellyanne Conway, who was Trump's press secretary at the time, was being challenged. I forget what the particular issue was. It was a piece of public policy. And she wasn't really answering. And the journalist said, but these are the facts. And she said this defining moment where she said, well, you have your facts and I have alternative facts. And that I just thought that was the watershed moment where so then there's nothing then that we can talk about. The granite on which we stand does not exist then. And that quickly turned into the fake news movement, and which has been popularized, and it's now part of our vernacular. And the minute that you read something that you disagree with, you need only call on Trump's, two-word dismissal, and you are validated. Yeah. So there's no question that the Trump factor is real and resonant and definitely flowed across the border northward. There's no question about that. There's lots of Trump lookalikes and soundalikes who have seized upon that messaging. And the timing is unfortunate because that then folded into COVID. So which was a huge journalistic moment, event, period. And again, where because it was on our lips, it was so easily conjured to dismiss so much work and so much important work for which anyone disagreed. There was language then. There was a catchphrase for it. And I'm not sure it'll ever go away. I think it changed the public mindset forever.
Yeah, those are excellent points. And frankly, as someone actually who has been targeted by this ex-president's son and actually receive all the hate that came with it, it's been pretty enlightening actually to see. So yeah, I think those are excellent points. Mr. Steiner, did you have anything to add on this government piece? And if not, I'm also happy to wrap up this session today.
The only last thing I'd say is sometimes, maybe because we're Canadian, we reach more readily to the government for a solution. And I place huge value and store in the government in areas where it should be operating. This, I don't think, is one of them, to be honest. There's been an effort in this country. In fact, there's policy in this country to support journalism and to support newsrooms. Now, we've benefited from that indirectly. In my program, Canada has, and a lot of the newsrooms actually have. But the problem that arises is that it then puts the government, or notionally arm's length, advisors to the government, in a position of having to choose what a newsroom is and what a newsroom isn't. And I've been in conversations where the decision gets made that a newsroom is something that looks like the Toronto Star, the Globe and Mail, or CBC. A newsroom is not something that looks like a particular startup, the local, or something else that may serve a smaller community or something like that. I think they've rectified that to some degree. And certainly the Toronto Star and the others deserve any support that they can get. Absolutely, there's no question. But I worry when the government is put in a position of deciding what a news organization is. It's a no-win situation, and it's not really an appropriate thing for a government to do in a free, open society. I think that this is sort of well, there are probably government policy levers that they can place to make financing more secure for all media, but picking winners in media is a bit of a problem. So that's the only thing I'll say.
Great point. Okay, so with that, I think we're going to wrap up this panel today. So first of all, to Rob and Rob, both our panelists, thank you so much for your really thoughtful and enlightening responses, and really this fantastic conversation that we've had. I've learned a lot, and I really truly hope that everyone in our audience has also, learned a lot and will be taking some of these learnings with you into your personal and professional spaces. And so thank you all for attending this very special Dalalana School of Public Health event. Please be sure to take our quick post-event survey. The link has just been included in the chat. And this is to let us know what topics you'd like to hear about from the school next. I'm going to give everyone a couple of seconds to locate that link in the chat. But otherwise, thank you so much for joining us today on this Friday evening. We've had fantastic conversations, and I'm very grateful to share this space with both of you today. So thank you for being here, and thank you all for attending as well.
Thank you for your work, by the way, because it's been hugely helpful in Canada.
Oh, thank you. Thank you. Appreciate that.